So looking at another beautiful concept, this is what is known as the ECC. So they said that the emergency cesarean consent. All right, cesarean section is what we know. All right, is if a woman is not able to give birth through the vagina, they have to cut the abdomen in an incision which we call the fin and steel incision. You understand? So the consent is more of like they are trying to tell you that, please, we want to do this thing to you, can we do it? Do you understand? So it's just a critical part of respectful maternity. You have to respect the woman. You don't just go doing anything you want to a patient without taking consent from them. So it is especially done when time is limited and decisions must be made quickly. So that means you people didn't actually prepare for this cesarean section, but you are trying to make the decision at the tail end. All right, so when is it needed? Okay, what could make people be making this decision late in treatment? So it may be required if complications arise during labor or pregnancy. You people didn't prepare for it. The woman's cervix was okay, everything was okay, but during the course of childbirth, some complications came up. You understand? So complications like fetal distress, the baby became so tired, labor was not progressing, there was too much bleeding, or the woman was now having high blood pressure. All right, then life-threatening emergencies generally. Do you understand? So there were no problem when they were trying to examine the woman, examine the baby, but some problems came up within the time of childbirth. Do you understand? Some things that people could not actually control. So consent process. Category 1, emergencies most urgent. Verbal consent is usually acceptable due to time constraints. You can just consent is a patient can even sign. Do you understand? But for this one, there's not really much time, so you just want to do things so quick. All right, category 2 and 3, written consent is preferred when you have time. Do you understand? So you write it, the patient has to sign and all of that. You get. Even for the one that is verbal, if you have a phone there, you can record it. Do you understand? Because obstetric and gynecology is that part of medicine that has a lot of lawsuits flying here and there. Do you understand? So you just have to protect yourself and all. So this is a woman that wants to go in for cesarean section. All right. So respectful maternal care. So even in emergencies, informed consent should include clear communication. Explain the best you can to the person. All right. Patient understanding and the patient to voluntarily agree. Involvement of the partner, of course, the partner of the person and the families should all be there and all of that. Okay, so this is just what respectful maternity in emergency cesarean consent simply means.